But today, and Dr. Shaw should follow me in talking about starting conversation about obesity in the office, I will be focusing on starting a conversation about diet in your office. So what I'm hoping to cover is recommendations related initiating that diet-related conversation with your patient, some strategies for effective but ideally brief dietary assessments, and providing unbiased diet-related advice. I didn't feel like I could have this talk without addressing weight bias, which is something that I'm pretty passionate about, but I see it in what my patients describe to me in some of their interactions with providers, not our providers, of course, but former interactions when they have been seen anywhere and work into the medical field with family. And we know that weight bias is actually highest among family members and among medical professionals, which is unfortunate. So we know that patients with obesity experience weight bias, and that bias and stigma towards them actually increases morbidity and mortality independent of BMI. It thus leads to reduced motivation to engage in healthy lifestyle behaviors, so we're not moving in the right direction. We're actually going in the opposite direction of where we'd like to see these patients. So as healthcare providers, the first step for you to ideally would be to have a personal awareness and take some thought to assess your even unintentional bias towards people with excess weight. And our goal is really to avoid stigmatizing and providing overly simplistic narratives. The study by Wharton and Associates, I liked this quote: "Move beyond simplistic approaches of eat less, move more, and address the root drivers of obesity." And I'm not arguing that our patients need not to eat less or move more, and it is calories in, calories out. But I think that patients know that and they kind of become numb to that phrasing. So what I like to do in my office and what we're encouraging providers to do is to dig a little bit deeper. All right, so I'm going to ask you what your thoughts are in terms of healthcare providers spend how much time with patients who they perceive as unlikely to be adherent. So your assumption is that a patient is not going to be adherent with the advice that you're going to give them: medication, diet, exercise. Are providers spending more, less, or about the same time with these patients? You guys are fast. All right. You're right, it's less, and that's opposite, right? I go back to thinking of working with a child or thinking in the teaching realm. If you have a student who you don't think is going to do well on a test, wouldn't your assumption be to spend more time with them? But what we see is that healthcare providers are actually spending less time with patients if they don't think they're going to adhere. So again, we're going back to this cycle. We have found in research that providers build less rapport with patients who have obesity. They spend less time in patient education activities. They spend less time in patient-centered care. Then there is greater avoidance of healthcare by these patients, poor well-being, lower motivation, higher calorie intake, greater exercise avoidance. So all of our intention to help obese patients lose weight actually worked in the opposite direction when they associate weight bias or when they feel that weight bias. I think most physicians or medical providers would be familiar with the 5 A's, but in spinning it to obesity, it is important to first ask permission to talk about someone's diet. In my realm, Dr. Shaw will be speaking on talking about obesity specifically. Assess their story, and I know that this is where we get a little bit nervous about the patient starting with, "I was a 10-pound baby," and going through their entire medical history or personal history, but I'll pull out some key questions you could ask. Advising on management, but more importantly, agreeing on goals and assisting with drivers and barriers. I find that knowledge in most of my patients is not the barrier, so we got to get to, again, those root causes, those root drivers.